Hi, this is Eric Gazel, the Clark County Health Officer. It's Sunday night, March 8th. I thought I'd do another COVID-19 or coronavirus update as there have been some significant local developments. As of right now, there are 500 cases in the United States in 33 different states. There have been 21 deaths. A majority of these are in nursing home patients. There are 4 cases in Kentucky, including one in Jefferson County, which is the greater Louisville area. There's also 1 case in Indiana, which is in Indianapolis. It is reasonable to assume we'll start seeing our first cases in Clark County soon. Whether it be a few days or a few weeks, we do anticipate seeing some local cases. I think the sooner we understand that, the better everyone will stay calm when it does start happening. Recommendations, you're going to get tired of hearing me say that because there's some general basic principles that we all need to practice no matter what the situation is. Wash your hands frequently, at least 20 seconds using soap and water. If that's not available, hand sanitizer is okay. You want to disinfect all surfaces, cover your mouth when you cough, stay home when you're sick, don't touch your face, and you can avoid handshakes, do the elbow bump thing when it's appropriate. Some other reminders: stay home when you're sick. Employers, waive your work excuse requirements. This is not the time to send somebody in for a healthcare visit just to get a work excuse. Remember, only go to the ER when symptoms indicate, not just for testing. So if your symptoms are such that you would normally go to the ER, even in the absence of this coronavirus scare, that's fine to go. Otherwise, stay at home. Remember, a vast majority of those affected will only have minor symptoms. The main risk at this time is for interruption in essential public services and the economic impact of the quarantines of people who are exposed because they didn't take appropriate precautions. And last, but probably most important, stay calm and make good decisions. Some new considerations we haven't talked about. They're recommending through the State Department that people avoid cruises for the short time being. People over 60 with chronic medical conditions like diabetes, congestive heart failure, COPD, things like that. They're recommending you avoid large gatherings, large public gatherings, and those who are ill. This would also apply to people who are on immunosuppressant drugs or chemotherapy. And also limit screen visitors to nursing homes. So a majority of our deaths, like I said, in the United States have been nursing home patients. So the more we can protect them, the better. Some of our local nursing homes have already started some strict screening precautions on visitors, and I commend them for that. Testing, I want to remind everybody it's still not available at patient request. It requires State Department of Health approval. Right now, it's limited to those who travel to affected areas like China, Italy, Iran, Japan, and South Korea, or those who've had contact with known positives. The last scenario is those with severe respiratory illness requiring hospitalization to higher levels of care without an alternative explanation. So, this would exclude people with the flu or people with COPD that have frequent exacerbations, things like that. I will say we are likely to adjust the testing indications as we see more cases and have more test availability. This is another one I just want to stress that this is not, if you go to the ER to be tested and you don't meet these criteria, you're very unlikely to be tested. So what next? What now? We'll continue these updates as the guidelines and recommendations will likely change rapidly over the next several days as things develop around us. Again, remember the same basic principles of infection control: covering your mouth when you cough, staying home when sick, washing your hands. Those are always going to be the best means of prevention no matter what the situation is. Also understand local cases are expected. We've been preparing this for weeks. So when you do hear about cases, again, stay calm and make good decisions. We are ready for this. So important numbers to know. Again, health info, which is our Clark County information line. You text health info to 888-777. And this is only for significant updates. We will not send daily updates out or anything like that. The Indiana State Department of Health and the CDC hotlines are on here as well. CDC.gov has good coronavirus information, and our clarkhealth.net, our health department website, and also our Facebook page will have updates as well. Please, if you can, avoid calling the health department phone line direct for general questions. Reserve those for exposures or illness, things like that. We've been getting a pretty overwhelming volume of phone calls, and the more you can free us up to do our regular jobs, the more we can protect you as our citizens. So again, thank you, and we'll keep you updated as things develop.